All right, today we are diving into the story of a really unique medication. It's not so much a cure, it's more like a chemical fence. It doesn't gently nudge you away from cravings. Nope, it screams a physical warning right in your face. Let's get into it.
I mean, just think about that for a second. What if there was a pill that didn't just help with the urge to drink, but actually physically punished you if you did? That's the powerful promise and, yeah, the threat of the drug we're looking at today.
And that pill exists. It's called Disulfiram, though you might have heard of it by its old brand name Antabuse. Its whole job, its entire reason for being, is to be a deterrent. By making sure you'll have an awful physical reaction, it builds this massive psychological wall against drinking. It really simplifies that choice to stay sober.
So you might think a drug this intense was designed in some high-tech lab specifically for addiction treatment, right? Well, you'd be wrong. Its origins are in a much grittier and frankly unexpected place, an industrial rubber factory. Okay, so picture this. It's the 1940s, and disulfiram is just a chemical used to make rubber stronger. But then people started noticing this really bizarre thing happening. Factory workers who were around this stuff all day would get violently, horribly sick if they had a drink after work. This weird little fact eventually caught the ear of two Danish researchers, Jacobsen and Halt. And get this, they actually tested it on themselves to confirm the link. By 1948, this random industrial chemical was suddenly on its way to becoming a groundbreaking medication.
So how in the world does this actually work? What is the science behind this insane effect? Well, the answer is that it basically hijacks one of your body's most important metabolic assembly lines. See, normally, when you drink alcohol, your liver has this really efficient two-step cleanup process. First, an enzyme called ADH turns the alcohol into a toxic chemical called acetaldehyde. This stuff, by the way, is the main reason you get hangovers. But normally, it's no big deal because a second enzyme, ALDH, swoops in almost instantly and turns that toxic stuff into harmless acetate. It's a super smooth process. And this is where disulfiram just throws a giant wrench into the whole system. It lets step one happen just fine. The alcohol still turns into that toxic acetaldehyde. But step two, it's blocked completely. Disulfiram shuts down that second enzyme, bringing the whole assembly line to a screeching halt, right at its most poisonous stage. The result? Well, it's a toxic traffic jam, a massive pileup. With that second step blocked, the acetaldehyde has nowhere to go, so it just floods your system. We're talking concentrations that are 5 to 10 times higher than they'd ever be normally. And that toxic overload is what unleashes the reaction. So, this reaction, this is the whole point of the drug. It's designed on purpose to be so incredibly awful that it creates this powerful, unforgettable aversion to drinking alcohol. And believe me, it is swift and it is brutal. We're talking it can start within just 10 to 30 minutes of your first sip, and it can last for hours. It's a prolonged, absolutely miserable experience. The symptoms hit you from every angle. You get this intense flushing in your face, you start sweating, your heart just starts pounding out of your chest, your blood pressure can drop, and then comes the severe, throbbing headache, intense nausea, and just forceful vomiting. It's a full body assault that is physically impossible to ignore. And here's something that is absolutely critical to understand. This reaction isn't just triggered by having a beer or a glass of wine. Even tiny, hidden amounts of alcohol in other products can set it off. We're talking things like mouthwash, some cough syrups, and even certain perfumes or aftershaves absorbed through the skin. It means you have to be incredibly careful. Okay, so with a reaction that intense, you have to wonder, where does a drug like this fit into modern treatment? Well, the key is to see it not as a cure, but as one very specific tool in a much bigger toolbox. I think this quote really nails it. Disulfiram is a pharmacological fence. It doesn't fix the underlying reasons for addiction, not at all. But by making it impossible to drink impulsively, it creates this protected space, this window of time, for a person to actually engage in therapy and counseling. It basically enforces sobriety so the real work can begin. Now, because that reaction is so hard on the body, especially the heart, this drug is definitely not for everyone. People with severe cardiac disease, a history of psychosis, or who are pregnant just can't take it. It makes close medical supervision an absolute must. It's really interesting to compare disulfiram's whole strategy, aversion therapy, with newer medications like naltrexone. Naltrexone works completely differently. It tries to reduce cravings and block the pleasurable buzz you get from alcohol. So you have two very different philosophies. One makes drinking a miserable experience, and the other tries to make it a pointless one. The right choice really just depends on the person. And one final critical piece of information. This stuff sticks around in your system for a long, long time. The effect can last for up to 2 weeks after you take your very last pill. That means you could stop the medication, have a drink 10, 12, even 14 days later and still get that full, horrible reaction. So all this brings us back to the big question, right? In our age of increasingly personalized medicine, is this chemical fence, a drug discovered by accident in a rubber factory, still a powerful tool? Or is it maybe just a blunt instrument in a field that really demands more nuance? That's a debate that continues to shape how we approach treatment today. Thanks for tuning in.